Number 4, Abitibi-Témiscamingue. Thank you very much, Mr. Speaker. It gives me great pleasure to speak to this bill today. This is a very important bill because we're talking about impaired driving, and this is a plague on our roads. It's a very serious issue, and I think it merits our attention, and that's why the NDP has decided to consider it and support Bill C-46 at second reading. Currently, however, we still have questions about it that we have not received answers to. And I would have to say that personally, I haven't decided what my vote in the end will be at third reading and report stage. Oftentimes, when you're talking about second reading, it means that you have an opportunity to look at the principle underlying the bill. And this is an important time because impaired driving is an issue. And I think that it goes without saying that this is important. Now, at third reading and report stage, you have an opportunity to decide whether the final legislation actually does meet the concerns raised by the principle being outlined at second reading. Now, I have some questions. Do you know, in medicine, there's a concept regarding the tolerance of a drug. When you drink, you can perhaps get used to drinking. However, your body does not develop any sort of tolerance. So if you take someone who doesn't drink and then that person decides to start drinking on a daily basis, that person can't expect to be able to drink unlimited amounts because his body has developed a tolerance. You can expect the same effect of alcohol on a body, on a person, regardless. So it depends more on the dose. If someone drinks 3 beers, they'll have a certain number of symptoms, and someone who's drinking 5 or 6 will have other kinds of symptoms. And the clinical table of the symptoms of this kind of drinking is pretty clear. There can be variations, but those variations are very small. Now, when you take certain drugs, there is this tolerance effect. What does that mean? It means that the body starts getting used to these drugs, and it requires higher and higher doses in order to get the same effect. For example, let's take morphine and fentanyl patches. When you start treating a patient suffering from cancer, you start giving that patient fentanyl patches, and that should provide relief to the patients. But as the disease progresses and the patient continues to take that drug for longer, their body becomes accustomed to it, and it requires higher and higher doses in order to get the same relief. Tests have been done. It's not really a test, but there have been a kind of test done in the past where a cancer patient was given fentanyl patches, and they continue to give the patient fentanyl patches to provide relief. And if that patient needed more relief, they gave higher doses or more patches, up to 140 fentanyl patches on that patient, and it was tolerated. Now, Mr. Speaker, I can assure you that anyone here in this House who would have taken that dose would die right away, without question. So that's an example of this tolerance that people can develop. And when people take medication or substances that involve this tolerance effect, if you try and establish a specific amount or dose that leads to impairment, you won't succeed because they will change depending on the individual and depending on the time, the length of time for which that individual has been taking that substance. So it becomes very difficult then to decide on any sort of threshold or limit beyond which there is impairment, for example. After which, for example, it would be dangerous for any given patient to take a higher dose. And that's because of this tolerance that they develop. If you're using marijuana, for example, the same tolerance effect seems to apply. The effect will vary from person to person. So if you decide to go and set a blood level, for example, or for a specific dose, that won't necessarily apply to all individuals across the board. For some, that amount won't have any effect. And for others, they won't be able to function at all. They may even just fall asleep. There are those who may take a quarter of the dose, that is that blood limit, for example, and it will be dangerous for them to drive because of the effect it has on them. So if you arbitrarily set a blood level, and then you end up having people who are driving dangerously with less than that dose because they're impaired, well, then some people will fall through the cracks, some people who are actually driving impaired. On the other hand, you may end up convicting people who, in fact, actually weren't driving impaired because they had developed that tolerance I'm referring to, and so their body was accustomed to that level of marijuana. So coming back to this bill then, if you decide on a specific dose, I think that will lead to problems and cases going before the courts. I spoke to some defense lawyers and criminal experts, and what they've said is that there's no actual scientific study that allows us to decide at what level there is impairment. So if you want to be able to prove that someone is impaired, you probably have to look at other methods. Other methods that are used, for example, for other drugs for which people can develop a certain amount of tolerance. There are tools and tests that police services have that can be used to determine whether yes or no that drug is present. So you could, first of all, screen for the presence of a substance. That's a good test. So let's say, for example, that a police officer suspects that there's been consumption, and you give that test, and you confirm it. So you know that that substance is present. And then you have to look at other tests. For example, tests that are used for people who are driving drunk, for example, being able to walk a straight line, for example. There are other tests like that one that will be able to show us whether or not that person is driving impaired. And if we use those kinds of tests, then you'll be able to prove that that person was driving impaired. They're unable to perform the actions that are required. They don't have the cognitive or physical abilities to do the tasks being assigned to them that a person who isn't impaired would be able to do. So I think that's an interesting option to consider and has a better chance of succeeding before the courts. I think that it's clear that we can't implement a bill without knowing whether or not what we have in the bill will lead to convictions or not. Because we may end up being simply demolished before the courts, and we won't have gone any further because of that. Cannabis will be legalized, and then we won't have the tools that we need to be able to lead to convictions when someone has in fact been driving impaired. So those are the concerns that I have about the bill, and that's why I don't necessarily know what my final vote will be. I think it's absolutely important to take into account individual variations when it comes to the tolerance of a substance. And I think we also have to consider the fact that there are people who are using marijuana for medical reasons, whether or not this substance is legal. And we still haven't been able to determine whether or not a marijuana user, a medical marijuana user, is impaired. What we've all realized, or what has been determined, is that a blood level is not sufficient to determine impairment. And so we have to find more effective ways of deciding whether or not someone is impaired. And then that would make it more likely that there could be a conviction. So I think there's still a significant amount of work that remains to be done, and I think we have to base this work on science. And what science is telling us to date is that There is no blood level really that can indicate to us whether or not someone is impaired from their marijuana consumption. And that's why I think we need to use another model, another test to find out whether someone is or is not impaired. Thank you, Mr. Speaker. The Honourable Parliamentary Secretary to the Minister of Health.
Thank you very much, Mr. Speaker. I thank the member opposite for her remarks, and I just wanted to ask a question on her last point concerning science. And I want to, first of all, assure you, Mr. Speaker, and this House, that this government very much desires to introduce evidence-based policy. And to that end, we have relied on the advice of the scientific community, as represented by the Canadian Society for Forensic Scientists, who have established a drugs and driving committee which is made up of scientists, and we have asked for their advice on the establishment of per se limits and the approval of devices which can test for that limit, those oral fluid test kits. And so we have made a commitment to seek evidence based on the science, not on news accounts of science or people's opinions, but we've gone to the scientific community. There is in this country a bona fide recognized body, the Canadian Society of Forensic Scientists, who have a committee a driving committee which gives advice to government on the approval of devices and standards to be set for them. We have sought their advice. They've established a committee. They've done the research, and they are providing us with that evidence. And I'm asking, through you, Mr. Speaker, if that would address the concerns expressed by the member opposite with respect to the importance of science to inform this debate.
The Honourable Member for Arbitrary. Thank you, Mr. Speaker. Well, what I'm trying to say is that in terms of the blood concentration levels, experts don't agree. And so it becomes very difficult then to say that at a specific dose someone is impaired or not. Now, if you move on to other scientific tests, for example, if you do a cognitive test, if you ask of a person that they perform certain actions and they're unable to, then that is evidence that the person is too impaired to drive. So it may be simpler for the government and for police services to perform those kinds of tests in order to be able to prove that someone is unable to drive, because then you would be making a specific link between their inability to perform certain actions and their ability to drive. If you're, for example, looking at reflexes, well, then you would look at their physical ability to react or not, and you may determine then that their reflexes are very slow, and you'd be able to make that connection between the consumption of a substance and reflexes that lead one to believe that that person is unable to perform certain tasks. That would be more difficult to prove before the courts. If you want to take a blood sample, for example, well, in rural areas, it may take an hour or two before being able to take that blood. If I'm a nurse in emergency, well, my priority is going to be for those who are in a life or death situation rather than testing for THC in the blood of someone. So that amount of time goes by. And when you're doing these standardized tests, then it's much more difficult to be able to challenge the results of those, because you may have the video right before you there in the courts that are showing that that person is unable to drive.